So now that we know all about the cells, we're ready to look into the brain of multiple sclerosis. So let's talk about the L word, the lesion. The lesions vary when we look at them. And as pathologists, what we've done is we've tried to classify them depending on how they look. So there are the so-called active lesions, and these look very granular. I'll show you some pictures of what they look like. There are also the chronic active or the chronic inactive lesions, and these are large grey areas, what we call the grey ones. There are also grey matter lesions, so MS doesn't only affect the white matter, it also affects the grey matter. We can also see what we call shadow plaques, and these are areas of remyelination, so this is where the myelin is being repaired. And there are also lesions, what we like to term the pre-active lesions, and I'll tell you a little bit about those towards the end. What we've done here is we've taken a section through the brain of somebody that has died, and here are what we call the lesions. These are the ventricles, so this is where the CSF flows. This is the white matter, it looks whitish, and here's the grey matter on the outside. So the damage in the white matter, we have different types of white matter lesions. These are the grey lesions that I talked to you about. They look a bit greyish. These are the large grey ones. They're slightly shrunken, and if you touch them, they're quite firm, so it's like a scar. And they're often round the ventricles, so this is why we call them periventricular. These are the ventricles. There are also the grainy areas, and these are more soft if you touch the brain. They're slightly soft, and they're more difficult to see. We can't see them on this section here. And the damage to the grey matter, we can't see. So there is damage here in the grey matter, but you just can't see it with the naked eye. So let's have a look at the active lesions. So these are the sort of the granular lesions. They're much smaller than the grey, hard lesions. And inside the so-called granular lesions are macrophages. And we call them foamy because they start eating up the myelin, and they become like balloons. They're eating the myelin away. And that's why we call them foamy cells, foam macrophages. And in these areas, the myelin is damaged, so it's lost. The macrophages are eating up the myelin. The astrocytes, like I told you, they start forming a scar, ready to sort of try to repair, but they're also producing neuroprotective factors. The oligodendrocytes, the cells that make the myelin, depending on the type of damage that we see, sometimes the oligodendrocytes can be increased because they're trying to repair the myelin, and in other areas they can be decreased. And usually there's inflammation around the blood vessels.